So this morning I've been very lucky to have participants join us from all across the world to launch the Healthy Birds initiative. This is an initiative, it's really a collective action platform. You know, Japaigo, the Ministry of Health, and our collaborators coming together to be able to say, we are tired of newborn deaths, we are tired of, being unable to manage preventable deaths of newborns. So we are coming together to set up and initiate this collective action platform with the goal of reducing by 50% neonatal mortality and reducing low birth weight by 30% in the next 5 years. So as we're launching our initiative, we essentially have 4 pillars that we'll be working on jointly with other collaborators. The first one is impact. We want to make sure that activities that we do all contribute to the goal of reduction in newborn deaths. The second pillar is around innovation. We have so many things that have been tried, so many things that we know work, but they are not at scale. So we are hoping that we can find innovative ways which are known, take them to scale, and work with countries to make sure that they are in all counties, they are in all facilities, they are in all communities. The third pillar is around investment. Yesterday, when we were doing the IMNHC sort of preliminary report, it was noted that less than 30% of countries actually have budget lines for small and sick newborns. So the pillar around investment is an important component to make sure that we're able to mobilize both public resources from like treasury budgets, being able to mobilize philanthropic capital, being able to work with private sector so that we have resources that can support the newborn activities, interventions, and health systems components. The fourth pillar is around insight and action. What works? How do we make sure that that knowledge is familiar to another country, is familiar to another county, is familiar to another facility? So insights is about being able to package the how-to. How do you do this? How do you run solutions on newborn health and take them to other counties, other countries, and even other platforms out there? So that really is the 4 things we are trying to do in the Healthy Birds initiative. It's like as I mentioned, it's a collective action platform, so we are not working alone as Japaigo. We will have country partners. We have collaborators in country, and we'll also be looking to build more partnerships with various actors, innovators who have innovations and solutions to tackle newborn, academia who have the opportunity to teach best practices on newborn health, people in the financial and investment space who can again mobilize and work together to mobilize resources from different communities, different private sector actors, and even advocates and champions who will be able to make sure that the newborn as a health issue is still on the table. As we noted, we have 6 times more children dying compared to the mothers who are dying. So we have made progress in reduction of maternal newborn deaths, but we haven't made similar progress in newborn. And that's really what is motivating Japaigo to be able to invest in this newborn health initiative. Yes, I think from the conversations that have been going on around the IMNHC, really there has been an appreciation on the lack of continued investment in newborn health. And I think also there's an appreciation that some of the components of newborn health, for example, equipment, are very expensive. Equipment, for example, to deal with prematurity is a very high cost item. Products such as caffeine citrate that help deal with birth asphyxia are really costly products. So you find the level of investment has been low, and I think in the various sessions I've been attending in the IMNCH 2026, there has been that appreciation that there's a need to focus a lot more on the newborn health. So I think the advocacy and the conversations that are happening here are really going to help us put a lot more pressure on how we invest in newborn, equal to how we have invested in maternal child health. Okay. We will be working with, as the very first county in Kenya, we'll be working with Nakuru County When we sat down with Nakuru County and were looking at their data, it was very surprising to learn that over 1,000 newborn deaths happened in the last year. The year before that, that is in 2024, the number was similar to that, about 1,100. So there has been no change in the newborn mortality rates in Nakuru. And I think when we discussed, the appreciation of the problem was real. And we were very happy that today they were committing $1.2 million to be able to, put a lot more accelerated efforts on newborn. And we will be working with them to really catalyze and make sure they're able to achieve their goals on reduction of newborn health as fast as possible.